The next is about the Navagraha Kriti Vijnaniyam Adhyayam Vyakhyasamaha Yathovacha Bhagavan Dhanvantarihi. Now this chapters, set of chapters like about Navagrahas is a highly controversial issue, and somewhat there is a bit of confusion. In Sushruta, the Graha are limited to, the Graha chapter is limited to pediatric conditions, Balagraha. Balagrahanam Vidyanam Sadhanam Chapyanantaram Utpattim Karanam Jaiva Sushruta Ekamanaha Shrunu. It's related to the pediatric conditions where the children may have some presentations, clinical presentations, which is supposed to be or attributed to the Grahas, something extraterrestrial organisms. Skanda Grahastu Pratamaha, Skanda Apasmara Evaja, Shakuni, Revati Chaiva Putana Cha, Andhaputana, Putana Shitana Macha, Tasayum Kamandika, Naivamo, Navamo Naigameshascha, Yahat Pitu Grahasam Nitaha. The 12 grahas mentioned in Sushruta, 9 grahas mentioned in Sushruta are Skandapasmara, Shakuni, Revati, Putana, Andhaputana, Shitanama, Mukhamandika, or Shitaputana, Shitanama is Shitaputana, Mukhamandika, Naigamesha, and Pitra. Dhatri Matro Prak Pradishta Apacharat, Shaucha Bhrastat, Mangalachara Vihinana. Drastan, Drustan, Tarjitan, Taditan, Va Puja Hetu, Him Sihu Yete Kumaranam. The children, they tend to get affected by these grahas due to either the abnormal behavior of the mother or the caretaker. So it's a sort of now these are the important points. A abnormal response to the surroundings of the family issues may be one of the causes for the graha as such, or Shauchabhrastan, the hygiene is not maintained, or there is a behavioral abnormality, Mangalachara Bhiharana, if there is a behavioral abnormality, such conditions, such children, those who are exposed to such social, family issues and hygienic conditions, they tend to get affected by the grahas. Now, this will give you a clear idea like what could be the grahas later. Aishwaryasthastvena shakyaha vishante deham drastum manushe vishwarupaha aptam vakyam tat samiksha abhilasye lingani yesham yani dehe bhavanti. Those who are in a very comfortable situation where the family environment is good, hygiene is good, in such conditions the grahas would not affect. Now, what is the real graha as such? There is a lot of issue of controversy. In Charaka Samhita, you do not have this kind of a description of graha, but there is one description of graha apasmara. That's only the issue. Whereas in Ashtanga there are 12 grahas mentioned, not simply 12 grahas are mentioned, and there is a story in Ashtanga where Pura Gruhasya Rakshartam Nembida Shulapanina Manusha Vigraha Panja Saptastri Vigraha Sapgraha Skandho Vishakho Meshakya Shwagraha Pitrasannidaha Shakunihi Putana Shita Putana Adusya Putana Mukhamanditika Taddat Revati Shushka Revati. According to Vagbhata, the grahas were creations of Ishvara to protect Guha in that epic story. And these grahas are having the shape of human beings, and there again there are 5 males and 7 female grahas, and Bhagavata has mentioned 12 grahas. Now, the general clinical symptoms produced due to the graha badha are Tesham Grahishatam Rupam Pratadam Rodanam Jaraha Samanyam Rupa Mutrasah Drimbaha Bhru Kshepana Dinapaha Venasravaha Urdhva-dृष्टि Osta Danta Damsha Prajagaraha Rodanam Kujanam Sanyamidveshaha Swaravaikratam Nakhe Agasmat Paritas Swadhatri Angavilekhanam. There would be some behavioral abnormalities, either obsessive or maybe the this behavioral abnormalities if they are present there. Now, in the Charaka Samhita, there is only a description of Grahapasmara, Bhutapasmara, Grahapasmara as such, and the descriptions of the grahas are not mentioned. So there it is a sign of apasmara, where either it could be this motor or maybe the sensory, or absence disorders. Different types of absence disorders might have been considered as graha in such condition. Whereas in Sushruta, the description is about only the children who present with the behavioral abnormalities are considered as the grahas. Vagbhata has made a bit of compromise where you have both the behavioral abnormalities like continuous weeping and so on, as well as the maybe loss of interest or attention disorder, mood disorders may be the one, as well as a sort of the seizure-like activity where there could be rodhanam, kujanam, phenasrabaha, etc. Or even the systemic diseases might have been included in the symptoms of the grahas in Vagbhata. Now, whether the issue is what should be the interpretation of the grahas. There is sufficient description to say that grahas are extraterrestrial organs and they enter into the body and they produce the diseases. So many people might have usually comment the grahas as a microorganism. But in Sushruta, there is a very specific chapter which we will deal with in Uttaratantra, 60th chapter, is Bhuta Abhishanga, where the infective disorders are very clearly mentioned, and the characters of the infective disorders also are mentioned. Infective organisms, microorganisms, that's microbiology of Sushruta. We will come when we will discuss in detail when we go into the 60th chapter, Uttaratantra 60th chapter. There it's very clearly mentioned like Guhya Anagata Vijnana Manamastha Asahishnuta Kriyava Manushi Yasmin Sagrah Parikirtite. A graha is mentioned as a condition where the patient would have a behavioral abnormalities, or maybe a person may have a perception which is beyond that. It's just about the psychological condition. Whereas the bhutas, the rakshasas or bhutas, which may affect they may affect the body with an idea or with the intention of either hurting the person or maybe having a compromise or living with the body. And the unhygienic conditions are the causes for the bhuta conditions or bhuta abhishanga. So there is a difference. Graha and the bhuta abhishanga, there is a difference. Probably all the microorganisms producing the infective condition, they are considered in the bhuta abhishanga, where the causes are ashuchim, bhinamaryadam, kshatam va yadiva akshatam, himsihu himsa viharatam satkaram artham atapiva. That's about the bhutas as such. So there is a difference between the grahas and the bhutas in Sushruta. Whereas in Vagbhata, a similar description of the factors are discussed in causes of the graha. Tribhi karane graha granantiha himsa rati archanakanksha graha grahana karanam. Grahas enter into the body either to hurt, that's organisms which are really producing that disease conditions, or that's what we call as pathogenic organisms, or commensals which live with the body, rati is living with the body, archanakanksha which expect some respect as such as the condition of graha. So there seems to be a bit of overlapping about the perception of the graha and the bhutas in different samhitas. So how to interpret the grahas now and to differentiate it from the conflict conditions? Now if you look at the present day situation, in the present pediatric practice, there is a group of disorders where all objective analysis fails to make the diagnosis, but there would be a child even presented with the multiple symptoms. Patients, the child's parents would be worried about the behavior of the child. The child may look like having many disease conditions, and primarily it's about the behavioral changes where the child may have a depressive feature, but this is not within all that definition of so-called these disordered conditions. And usually now Professor P.V. Sharma in Banaras, he used to describe such conditions like where the child would be taken to a temple or maybe to a priest after consulting a pediatrician. When the pediatrician fails to resolve the issue, all such conditions are to be considered as graha. That's absolutely true. in the sense like it's those conditions where there would be a behavioral abnormality which cannot be objectively discussed. Such conditions now are named as disruptive mood dysregulation disorder. It's a very complex word where there would be abnormality of the moods and there is a change in the behavior as a result of the mood conditions. Again, it's not a mood disorder, that's again very specific. Mood disorders are something different where the person would have a permanently change in the mood conditions, whereas disruptive mood dysregulation disorder is a name which was given very recently, some around 10 years back in the contemporary system in the DSM-5 classification. Very recent DSM-5 classification came into practice only in somewhere around 1996 or so on, somewhere around that, 1996 DSM-4, something like 2004 or so. At that time the DSM-5 came into existence, and there they have coined the name of disruptive mood dysregulation condition, and it's somewhat defined as a mood dysregulation syndrome is defined to capture symptoms that do not meet the criteria of bipolar disorder in children and yet lead to significant functional impairment. So all such vague presentations which cannot be objectively named as a specific disease entity, they are now considered as a mood dysregulation disorder, and probably all of them would have the same clinical symptoms as that of the grahas. Now, as per the current DSM-5 classification, the mood dysregulation disorders again are further grouped into intellectual disability, where the onset of intellectual and adaptive deficits during the phase of development. Child as it develops at one stage, the intellectual development seems to be reduced or attention is reduced. That's one group of conditions. Or there could be adjustment disorder where the child would be irritable in response to a known stressor with the onset of symptoms within 3 months of the stressor. If there is a stress event and the child doesn't respond to that stress properly and becomes irritable. Or neurocognitive disorder due to secondary general medical condition. Due to other conditions, the child would have abnormality of perception. Or attention deficit hyperactivity disorder, or ADHD, which is now very popularly used term, ADHD or attention deficit hyperactivity disorder, where the child would have inattention or hyperactivity and impulsivity. Autism spectrum disorder, a group of symptoms like autism, again well-known conditions. Autism and ADHD are now very popular terms which are used, where the child will have a deficit in social communication and interaction with the restricted repetitive patterns of behavior, which is well known. Then oppositional defiant disorder, angry, irritable and argumentative or defiant behavior as such. Or conduct disorders where the child would be violation of basic rights of others, that violent and hitting others and so on. Or post-traumatic stress disorder where the child would be exposed to exposures of trauma like event of death associated, etc., and then it becomes having negative cognitions, negative feelings about the life. Or persistent major depressive disorders where the child would be depressed and irritable mood in absence of many kind of hypomaniac symptoms. That psychological established disorders like bipolar or mania, they are to be ruled out. Then premenstrual dysphoric disorder in later adulthood, somewhat in the later part of the life, before the menstruation, the child person may have symptoms a week before onset and improvement within a few days after the onset of menses. Or psychodynamic bipolar disorders where hypomanic and manic symptoms would occur temporarily and there will be irritable mood. And substance medication induced disorder, another condition where due to the consumption of drugs, different sorts of the drugs, there could be problematic behavior or psychological changes associated with the introduction to various substances. Or schizophrenia spectrum disorders where it's not established schizophrenia. These are now named as the mood dysregulation disorders. Now, if you look at the clinical symptoms of grahas mentioned in Sushruta, other than that of the skandapasmara possibly, the symptoms are of the similar sort of the behavioral abnormality of the children. So I would not consider this as a psychiatric issue. See, many people would consider Graha as a pediatric psychiatry. Some people would consider Graha as infective group of the conditions. All of them are absolutely right. I am not saying that one is wrong and the other way. But a more objective perception would be of that kind of a mood disorders which tend to occur temporarily and where evidence-based diagnosis often fails, and you come to a situation where you will have to name with the vague names like all that different names. Now I have given you that different names which are by themselves are confusing. Such maybe conditions could be considered as Graha, and where no medical treatment really helps, and it's only that either there will be a spontaneous relief or many times all that esoteric approaches like maybe going to a temple or maybe worshipping or so on, they do help in the patients. Maybe such conditions may be considered as a Graha. Now many people even consider Graha as a one of the type of Daiva Vipashya, where only these puja and so on are to be considered as the treatment, but Sushruta has not considered these as only the Daiva Vipashya Sankhya conditions. The treatment otherwise, prescription of medicines also are suggested in Sushruta about the Graha. That's another of the interesting issue. So there a bit of go into the depth of further controversy would be, I think, unnecessary. But basically, there is a lot of overlapping issues about the concept of Graha in Ayurveda. Now we will continue with the description. In the Skanda Graha, the clinical symptoms are Shunaksha, Kshatraja Sagandika, Stanadvitu, Vakrasya, Hatha Charita Eka Pakshmanetra, Udvignaha, Sululeta Chakshu, Alparudi, Skandarto Bhavati Gadha Mustivarchaha. A Skanda Graha patient would have abnormal movements and there will be swelling over the eye, around the eyes. Child would not consume milk properly. The mouth or other part of the body, one part of the body would have abnormal movements. Typically myoclonic sort of the seizures, myoclonic movements would occur with maybe a sort of absence disorder. Overlapping absence and myoclonic disorders might be considered as a skanda. Then Nishchanya Bhavati Punah Bhavet Sasanya Samrabdaha Karacharanish Nrityatiba Vinmutro Sujati Vinadya Jirumbamanaha Penum Prasujati Trapsaka Bhinnaha Abhipannaha Skanda Apasmara conditions. It would be presented with the patient who completely loses the consciousness and then becomes conscious, and then there will be abnormal movements which looks like the tonic and clonic conversions, where there will be contractions and relaxations of the body of muscles, which Sushruta uses the term like Nrityativa, as if the patient is dancing, and there is a possibility of evacuation of the bladder and urine also. Such conditions are considered as the skandapasmara. It's a typical of tonic clonic convulsions with maybe the absolute loss of consciousness, which earlier we used to call as grand mal epilepsy. So probably skanda and skandapasmara grahas, they are related to the epileptic presentations of different sorts. Whereas in the other conditions, srastrangaha, bhayachakitaha, vihangagandhihi, संस्रावि व्रण परिपीडित समन्तात स्फुटेश्च प्रचितनु सदाह पाकैः विज्ञेयो भवति शिशु क्षतक शकुन्याः. Shakuni Graha in our patient child will be presented with the weakness, there will be apprehensive behavior, and there could be multiple wounds over the surface of the body, maybe self-inflicted or otherwise. So it's a behavioral abnormality which may be related to the mood disorders which we have referred to. Then in case of the Kumara Graha, these Revati Graha, रक्तास्य हरितमलो अतिपाण्डुदेहः श्याम वा ज्वरमुखपाकवेदनार्थः रेवत्या व्यथिततनुश्च कर्णनासं मृद्नाति ध्रुवम् अपिपीडितकुमारः. The Revati patient would be Vathitadanu, would be having a depressed behavior, and the patient's physical nourishment also would be affected. Hence the patient would be anemic or the looks depressed as such. Even there could be systemic symptoms like jwara, mukhapaka, etc. Putana condition, Srastranga, Swapiti, Sukham Diva, Narato, Vidbhinnam Srijaticha, Kakatulya Gandhi, Chardyarto, Hrishita Tanuruha, Kumaraha, Trishnaruhu, Bhavati, Putana Grihitaha. Putanagraha patient would be sleeping more at the daytime and would remain awake at the night time. So the biological life cycle would be altered, and the child would be passing the stools which would have the smell of crows, kakatulya gandhi, like that of a crows. Of course, to identify which is the condition exactly would be difficult, but I would consider again this as a sort of the mood disorder, that mood dysregulation symptoms, conditions where the child would have anorexia, nausea, and the sleep cycle being altered. Thadyartha Shrishritanu, the child would also have more of vomiting, frequent vomiting, or thirst also. यो द्वेष्टि स्तरम अतिसारकास हिक्खा छर्दीभिः ज्वरसहित अभिरद्यमानः दुर्वर्णः सततम् अधश्रयो अम्लगन्धिः तं ब्रूयुः भिषज इह अन्धपूतनार्थम्. Andhaputana would be producing a physical presentation where the child would have anorexia, vomiting, and even fever, and there would be pain throughout the body, and the child development would be affected. And there will be amlagandhi, some sour smell from the body. It's again a physical condition where there could be some clinical presentations of the diseases. Now, psychological conditions presenting as a somatic presentation is exactly the same. Udvignaha bhrisham ativepate pranudyat samlinaha swapiti cha yasya antrapujaha visrambo bhrisham atisaryate cha yastam janiyat bhrishigah shitaputanartam. Shitaputana patient would be having anxiety, excited behavior, udvigna, and tremors could occur, and weeps more, and even sleep cycle would be altered, and there could be andrapujaha, barbarigmi like conditions, and that even diarrhea could occur. Such conditions are Shitaputana conditions. Then Mukhamandika is Mlanangaha, Suruchira Panipada Bhaktraha, Bhakwashi, Kalusha Siravuta Udaroyaha, Sodvego Bhavati, Mutatulya Gandhihi, Sadneyaha Shishuriha, Vaktramandikaartaha. A Vaktramandika involved patient would be having Udvega, anxiety, and there would be physically, the patient would be having a relatively lesser growth parameters, but the limbs would have normal appearance, tends to consume more. There could be these multiple vessels seen over the surface of the body. That means the emaciation signs, and the whole body will be smelling like that of urine. Yah penam mamati vinamyate cha matye sodvegam milapati cha urdhamikshamanaha jwaryeta pratatam ato vasasagandhihi nistanyam bhavati cha naigamesha Naigameshagraha person would have vomiting with the foamy vomiting, tend to bend the body forwards, and there will begin anxiety, even weeps occasionally, looking upwards, and there could be jwara, fever also, and the whole body would be smelling like of vasa. This is the signs of Naigamesha. Prastabdo yastanadveshi mukhyate cha avishan muhu tam balam atiradhanti graha sampurna lakshanaha. Any child which is having a total stanadvesha, that doesn't consume the food, or there is a tendency for having a rigidity over the body, such conditions can become incurable or even fatal. Viparita mataswadhyam chikitsev achiradham, a fresh condition where the history is for a short duration and the otherwise the clinical symptoms are lesser, they can be managed. The general line of the treatment in grahachara, grihe purana hamisha abhyadya balam shuchau shuchihi sarshapan prakirettesham tailehi deepam chakarayet sada sanhitam chapi juhyat havyavahanam सर्वगंधौषधबीजैः गंधमादीः अलंकृतम् अग्नेये कृतिकाभ्यश्च स्वाहा स्वाहेति संततं नमस्कंदाय देवाय गृहाधिपतये नमः शिरसा तो अभिवन्देहं प्रतिगृह्णेषु मे बलिं नीरुजो निर्विकारश्च शिशुं मे जायतां ध्रुवम्. The general, the common prescription or management of Grahapata, or even for a prevention of the Grahapata, Daivapasha is suggested, and Daivapasha is by burning a light with the Sarshapataila, keeping around the room, in a child kept in a room where the light with the Sarshapataila is burnt, so that the Sarshapa vapors would be presented around. And then a homa, Havana has to be done, where Agni, Kritika, Devatas have to be given this these offers, and the mantra is Namaskandaya Devaya Grahadipataya Namaha. With this, we conclude the first chapter of Graha Chakitsa. Iti Sushil Samhitayam Uttaratantrante Kumaratante Navagraha Pratibhijjaniyo Nama. Now, Adita Prasamodhyaya Satyamshodhyaya, 27th chapter from Uttaratantra, but from Graha Chakitsa it is the first chapter. Now, the next part would be the Skanda Graha Chikitsa. We will go to the next chapter. अतः the Skandagraha Pratishedam Vyakhyasyaamaha Ithavati Bhagavan Dhanvantarihi. The treatment protocol for the Skandagraha. Skandagrahopasustanam Kumaranam Prashasre Vadagna Dhurmapatranam Nishkyavataha Prashyate. Now, in general, in all grahas, Devavapasya like Havana is mentioned as a protocol of the treatment, but Sushruta gives all the details of the other medicinal treatment also, and the treatment in Skandagraha condition would be Vadagna Dravya Kwatha has to be given as a Parisheta. Tesha Muleshu Siddham Tailam Abhyanjanizam Sarvagandha Sura Mandakaihi Mandakaidarya Avapam Ishyate. The Taila Abhyanga with the Vatagna Dravya as well as Sura Gandha Dravya, smelling substances or volatile substances, Kaidarya have to be given. Then the drugs of Devadaruni Rasnayam Madhureshu Drumeshja Siddham Sarpishya Sakshiram Panam Masmai Prayojayat Sarshapaha Sarpanirmoko Vaja Kakadri Kridam Ustra Aja Avigavam Chaiva Romani Udhupanam Shishoho Somavalli Indravalli Shamim Bilvasya Kantakana Mrgadanyashta Murani Kristanyeva Dharayat. The other protocols of the treatment is Grisapana with the Devadaru etc. Then Dhupana with the Sarpanirmoka, the skin or the layers of the skin of snakes which are left out, and then Kakadani Grita or the Ustra Aja Abi Gavam, the hairs of camel or goat or sheep or maybe cows, hairs have to be used for Dhupana. Then these Mudya Dharana, Mudika Dharana, wearing the drugs. Somavalli, Indravalli or Shami Bilokantaka over the body is one of the options of the treatment. Then the other options of the treatment are wearing the substance, these decorative objects like Raktani, Malyani, Tatha Patakaha, Raktashta Gandhaha, Vividashta Bhakshaha, Ghantat Devaya, Balir Nivedya, Sakukutaha, Skandagrahe Hitaya. Now, Sukukutaha, Skandagrahe Hitaya. The Skandagraha has to be offered the red colored malas, garlands, then all the decorative items like flags have to be used with red color, and the food substances with the different smells, and in the food substance, kukkuta, cock, this chicken has to be added, the bali has to be given with the chicken to these Skandagraha. Snanam Triratram Nishichattureshu Kuryat Puram Shaliyavaihi Namestu Adbhishcha Gayatri Abhimantitabihi Pradvalanam Vyahrati Bhishtabhnehe. At night the child has to be given bath at an area where four roads meet with. At the junction of four roads, the child has to be given a bath, and that water for bathing has to be processed with the Navashali Dhanya, and Gayatri mantra has to be uttered with the homas. For the this homa, Gayatri mantra has to be used for the ahuti. Raksham Ata Pravakshami Balanam Papanashinim Aha Nehni Kartabhya Ya Bhishakbhi Atandidehi Tapasam Tejasam Chaiva Yashasam Upusham Tata Nidhanam Yo Abhiyo Deva Sate Skandak Prasidito Graha Senapatir Devo Deva Senapatir Vibhu Deva Sena Ripuharaha Patutvam Bhagavan Guhaha Deva Devasya Mahata Pavakasya Jayasudaha Gangoma Kritikanam Ganga Uma Kritikanam Ja Sate Sharma Prechatu Ratamalayam Brashriman Dr. Sindan Bhushidha Ratalivapur Deva Pavam Kraunja Sudanaha. A prayer to Skanda, the Ishwara's son, is given, and this is another of the option. And that's about the treatment of Skandagraha Pratisheda. Skanda Pratisheda Nama Adita Dvitiyo Adhyayaha Ashtavimsho Adhyayaha. And we will go to the next chapter, Skanda Apasmara Pratisheda. अतः तो स्कंदापस्मार प्रतिषेधं व्याख्यास्यामः यतोवाच भगवान् धन्वन्तरिः. In the skanda apasmara, the treatment is bilvah shirishu golomi surasadishcha yoganaha parisheke prayuktavyaha skanda apasmara shantaye. There again is the parisheka, which is the first line of the treatment, where the drugs like bilva, shirisha, etc. are used. Then sarvagandha vipakvanti tailam abhyanjanahitam kshiravruksha kashaye cha kakolyadav gane tatha vipaktavyam bhusam chapi paniyam paisa saha. The given kshirapaka has to be given with the gandhavargas, volatile substances, for tail abhyangana. The taila with sarvagandha taila is to be used for abhyanga. As well as internal administration of kshirapaka with the kshiravruksha kashaya, kakolyadigana have to be given with the ghrita and kshira as such. Then utsadana, application of the dry powder of utsadana mochahingu yuktam skandagrahetam गृध्र उलूक पुरीषाणि केशाः हस्तिनका घृतं वृषभस्य रोमाणि योज्यानि उद्धूपने अपि च. बचा हिंगयुक्त द्रव्यस have to be used for application, and dhupana with the feces of grudha, eagle or uluka wool, their feces are used, or maybe the hairs of elephants or nails also can be used with the vrishabhasya romani, the hairs of bull also has to be used for the dhupana. Anantam kukkutim bimbam markitim chavidharayet. Patient has to wear ananta, kukkuti, bimbi, these dravyas have to be worn over the body. Pakva apakvani mamsani prasannaha rudhiram peha bhuta udano nimedyascha skandapasmarino avate. A bali has to be given in a forest with pakva apakva mamsa, that's flesh which is processed and not processed, with the alcohol. Prasanna is one of the variety of alcohol, and fresh blood and milk has to be given for the bali, and this bali has to be given in a forest. Chatushpadeja kartavyam sanamasya yatatmana. The child has to be given bath in a chatushpada, a junction of 4 roads. Skandapasmara sanyoya skandasya daitas sakha Vishaka Sanyasya Shisho Shivostu Vikritanana. The mantra which is to be uttered during these processes are the same. Skanda Pasmara Samyaha, Skandasya Daitasaka, Vishaka Sanyasya Shisho. With this, we conclude Skanda Apasmara Pratishedo Nama Adisa Tritiyodhyaha Ekonatrimsho Adhyaya, 29th chapter is over. So we will conclude today with this. If there are any questions, we will try to answer, and then okay, we will conclude today. We will continue with the next chapter.